Lithium is one of the cornerstone for bipolar disorder and is often used as a drug for major depression. A subset of patients develop chronic kidney disease, often requiring, sometimes patients may have to discontinue the drug, but that may lead to worsening of their symptoms. My name is Dr. Balwinder Singh. I'm an assistant professor in the Department of Psychiatry at Mayo Clinic in Rochester, Minnesota. The title of our article is Lithium and Kidney Disease. It'll be published in Mayo Clinic Proceedings and will be coming out in the January 2025 issue. So this is a commentary where myself, along with Dr. Urges and Dr. Gonzalez, we provide a summary of lithium and kidney disease. We reviewed the literature. We are providing a comprehensive summary about the prevalence, the confounding factors, or other covariates which could impact the development of chronic kidney disease. And are there ways to reduce the progression of kidney disease if someone is doing well on lithium, or ways to manage the renal disease or reduce the progression of the renal insufficiency? There are several causes for chronic kidney disease, and as we know, lithium is one of the gold standard drugs for bipolar disorder. There's one group of patients who do really well on it, and about 10 to 15% in some studies, they've shown that maybe up to 25% of patients may end up developing chronic kidney disease stage 3, where their glomerular filtration rate, which is a number by which we measure how someone's kidney is functioning, may go below 60. Now, in such cases, it's really critical to identify, are there other comorbid conditions? Because often what happens, we see someone's GFR will go below 60, and one of the most common things we observe is that their treating physician will end up discontinuing lithium. The problem with that approach is that it leads to a significant decompensation where patients may relapse, or their depression or mania symptoms may come back, and it can be difficult to stabilize those. There are some other conditions which can impact kidney function, such as hypertension, diabetes. So if you have a patient, you're treating a patient with bipolar disorder or major depression, and they're doing really well on lithium, and if you start to notice that they are developing chronic kidney disease, or their GFR is declining, we recommend to have a multidisciplinary approach where involving a nephrologist, identifying the secondary causes, and treating those very well, rather than discontinuing lithium as the first option. In most cases, as we treat their secondary causes, people do well. In this paper, we reviewed the literature and identified some patterns where, in some of the studies where we see a higher prevalence of chronic kidney disease, than in those studies there's a lack of adjustment for covariates. So it's important when we are looking at the lithium-related data and renal insufficiency that we adjust, or we take into account those confounding factors or covariates which could impact the kidney function. So what we are doing at Mayo Clinic is, when I see someone with a patient who has bipolar disorder, mood disorder, and they're doing really well on lithium, and they end up developing kidney disease, we try to detect it early on. We keep monitoring their kidney function regularly, and if we start to notice that their GFR is declining, we involve our nephrology colleagues. We look for confounding factors or other comorbid conditions which could impact. There are hypertension, diabetes, age. As with an increasing age, we start to notice a decline in GFR. So sometimes it could be a false indication that their GFR is declining, but it could be age-related decline as well. So we kind of adjust. We monitor those and intervene early. There are some medications which are FDA approved for chronic kidney disease. There is limited data, at least in the published literature, how do they interact with lithium or how well they do with lithium. We are looking at how do those drugs perform or how do patients do with those medications. At a lot of other institutions or places, the most common strategy if someone develops chronic kidney disease is people end up discontinuing. And the challenge with that approach is that, when we have someone who is doing really well on lithium and we discontinue, they will more than likely, those patients will decompensate. We had published a paper last year where the hazard ratio of someone who discontinued lithium, the hazard ratio was almost 8, that they had an 8-time higher risk of decompensation into a depressive episode or a manic or hypomanic episode. So our approach is not to discontinue lithium as the first line. We can have that as an option, but kind of look for other possible conditions which could be contributing and treating those well, and try to stabilize those conditions well, and see if we can continue to use lithium, which can be life-saving for a lot of our patients. So the goal of this paper is to provide a sort of a comprehensive summary to the clinicians. What is the current data regarding the lithium and kidney disease? What are the potential risk factors? What are the biases in the studies or observational studies which have been published? And also kind of give a summary of the latest studies where some of the later studies where they have compared development of kidney disease with lithium, and someone started valproate for bipolar disorder. They had sort of similar rates of development of CKD. So it's not just the lithium. I think it's we believe there are other confounders or other covariates or comorbid conditions which are contributing to the development of kidney disease, and often lithium gets the blame. So the message here is, if you have a patient who is doing well on lithium, look for secondary causes, treat them rather than discontinuing lithium as the first line option. Yeah, so for patients, if they are doing well on lithium and if their mood has been stable, especially for years, sometimes it can be scary to know that their kidney function is declining. So I always say, talk with your primary care provider, talk with your psychiatrist, and look for other causes for, are there other causes for kidney disease, and how could we manage those well? And there are treatment options which are available for chronic kidney disease, and to treat those, use those to treat the disease rather than discontinuing lithium. So I think there are options which are available. So lithium discontinuation is not the only option if someone develops kidney disease. So the next line of research we are studying right now, there's a class of medication called as SGLT2 inhibitors. Now these medications have, a couple of those are already FDA approved for chronic kidney disease. Right now we are conducting an observational study where we are looking at the efficacy of these drugs, this class of medication among patients who had mood disorder and they've been on lithium, and do these medication slow down the progression of renal insufficiency in those patients. We would like to conduct a randomized controlled trial in the future, but for now we are currently pursuing an observational study and just to see if those medications, how effective are these medications for chronic kidney disease in someone who is on lithium. I would like to invite you to read this article, and I hope you'll find it helpful in your clinical practice. Discuss with your colleagues and implement some of those findings in your clinical practice to help improve the patient care.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings. or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.